Okay, good morning, good evening, good afternoon, doctors, nurses, and pharmacists. I am Dr. Che. Can you hear me? Okay, today,
Yes,
yeah, we are waiting for one doctor to do speaking with us, speaking practice. So yes, Dr. Mobi Khalid can hear us, Miss. Okay, thank you. So just a few people can share the session with other doctors or nurses or pharmacists. That would be great. If you can't share, no problem. Just before the doctor comes, what I will do, I will just go through some, criteria. Okay, just in general, what OET wants us to fulfill the criteria. Okay, so then we will practice two role plays with a doctor. So we are just waiting for him. Okay, so can you see the screen? What you can see on my screen? Linguistic criteria, yeah?
yes,
Okay, Dr. Dilawar is there, so we don't have no time to explain it. But okay, Dr. Dilawar, just we were waiting for you, and just I was going to explain the criteria. So just I will go through quickly, just in 1-2 minutes. So we
Okay,
have
sir.
two types of criteria. Number one is linguistic. Number two is clinical communication criteria and speaking. In linguistic criteria, first of all, is intelligibility. Intelligibility means the pronunciation, okay, stress, intonations, rhythm, okay, your accent. It should be easily understandable. They don't want us to be like British, to be like English people, but at least the what you we will discuss, we will talk, it should be easily understandable for the reader. Okay, we should stress, we should give intonation, these things. Okay, it should be easily understandable. You should get at least 5 to get B grade. Okay, so it should be easily understandable. Your communication is not impeded by few pronunciation or prosodic errors. Means there should be no problem with your accent. There should be minimal strain for the listener to understand. So as we are talking to a patient, so we should keep things easy and simple, and it should be intelligibility, mean it should be easily understandable. Okay. Number two is fluency, means when you are talking, just be fluent. Don't just stop and then think what you are going to say next. Okay, so you don't need to think about the words or sentences, just keep in a natural flow. Don't make it over fast. Some people think that fluency means when you are talking very fast, it is fluent. No. So fluency, just the way, for example, I'm not talking fast, but the way I'm talking is fluent because I'm not stopping, I am not thinking what I'm going to say next. So this is some kind of fluency. So your speech should be completely fluent and you should not hesitate. Okay. You should not hesitate, and you should avoid repetition. You can do a little bit self-correction as a natural process, but don't overuse these things. Okay, so then appropriateness, for example, if you are talking with a patient, you don't need to use medical terms, don't use jargons, don't use technical language. Even if there is any technical term, any technical language, you need to make it easy and clear. So register tone like this means, so your way of talk, your words, your explanations should be according to the patient. Okay, you should not use jargons and overcomplicated language. Resources of grammar and expression. You can see this is just one of the criteria. So grammar, vocabulary, it should be also good. Okay. So this is also one of the criteria. So this is linguistic criteria, means the language itself, English language. Now we have a clinical communication criteria. This is second type of criteria. Within this, there are sub criteria. Number one is a relationship with the patient. This is one we not use the name of the patient. Okay, it should be good greeting. Okay, and it should be according to the nature of interview. It is a revisit patient. We should use according to that. Okay, you should demonstrate an attentive and respectful attitude, and you should demonstrate non-judgmental approach, means you should respect the patient, non-judgmental. Okay, you should show sympathy, empathy, and emotions for the patient. Next is just in understanding and incorporating patient's perspective. Okay, means when you are talking, you need to understand patient's perspective also. Don't just keep talking and talking and talking. Okay, keep ask, let the patient involve, okay, in the conversation, so that you can take patient's perspective in your conversation and you can answer accordingly. Then we have structure, providing structure. For example, it should be logically sequenced. First of all, at this point, secondly, I would say this and this, and finally this, like, okay, the next thing is this. Okay, this is sequencing. Okay, so when you are talking, just keep it natural and try to do some little bit sequencing or provide a little bit structure to the patient. The reason why we provide this structure, so that it is easy for the reader to understand what we are talking. Okay, other is getting information, data gathering, and other is next is giving information. When we are getting information, the main thing is don't ask more than one question. For the first of all, and listen to the patient actively, don't repeat the questions. Okay, don't use compound questions, means don't use more than one question at a time, and make things clear and easy. Okay, if there is any something you don't understand, try to ask the patient again. And the last is giving information. Don't give information in large chunks, give in small chunks, so it is easy for the reader to understand. Okay, so make it, divide it and make it easy. Keep checking patients understanding all of these things. Okay, doctor? So any question? Okay, now Dr. Daravar, this is your role play. Let me show you. That is on my screen. Okay, this is your role play. You will have 2.5 minutes to prepare. In this time, I will not be talking because you will be preparing. And okay,
Okay, sir.
so we just for the people who are on Facebook, you don't need to worry. Don't think that why we are silent, because like real exam, he need to prepare in 2.5 minutes, and then we will do the role play, and then I will provide feedback. So Dr. Dalal, your time starts now. 2.5 minutes to prepare, please.
Okay, sir.
Okay, let me know, doctor, when you are ready, please.
Okay, sir, I'm ready now. Sir, I'm ready now.
Yeah, let me just start the timer, please. 1 minute. Start, please.
Hello, good morning. My name is Dr. Laur. I'm the treating doctor for today. And how can I address you?
Oh, yes, doctor, I am Bashir.
Okay, Ashir, nice to meet you. How can I help you today?
Uh, doctor, I am here because I am having some problem with my bowel.
Okay. Uh, okay, for how long do you experience problem in your bowel?
For the last couple of days, doctor, almost 1 week.
Okay, can you please tell me more about your condition?
Uh, Doctor, I had a fracture of my femur,
Mm-hmm.
and then I underwent surgery here,
Mm-hmm.
and I was discharged home. And uh, but I know I am having this problem with constipation.
I see. Okay. So before we proceed, I would like to ask you a few more questions.
Yes,
Uh,
please.
do you have any other symptoms
Like what, doctor?
like vomiting?
No, doctor.
Okay. What about fever?
No, doctor.
Okay. And I would also like to ask about medication history. Did you take any medication recently?
No, doctor.
Okay.
No, I didn't take medication on my own. But I
Mm-hmm.
was given this medication that you people call as codamol like this.
Mm-hmm.
I was given this medication for pain. Yes, I am taking that medication.
Okay. I would like to know for uh, how long you take this medication.
I have been taking since my discharge, doctor. It was
Mm-hmm.
my discharge was 1 week ago.
Mm-hmm. Okay. And how many times per day?
I take, doctor, at the start,
Mm-hmm.
I was taking, I was told to take one tablet in the morning and one tablet in the evening. But doctor, this medication is very, very good. When I take it relieves my pain immediately.
Mm-hmm.
This is a wonderful tablet. Then, when I started feeling more pain,
Mm-hmm.
then I started taking two, three, up to five tablets one time.
Okay.
So it is helping me a lot. Yes.
I see. Okay. Uh, Mr. Ashir, actually, I believe that the constipation, the symptom you have, is related to the medication that you are taking. Uh, Let me explain to you. This medication is cocodamol. It's contained paracetamol for painkiller and also codeine. It affects your bowel. It causes constipation if you take it more than twice daily or 3 times per day. It causes constipation. Am I clear so far?
Oh, doctor, but it was helping me a lot in my pain.
Mhm. Okay, I appreciate your concern. Actually, I would like to offer you other measurement for relieving your constipation. Let me explain to you. The first one is taking high fiber diet, and the next thing you can do more exercise. You can move more, and the last one, which is the most important one, is taking fluids more regularly. And also, I suggest to take a paracetamol for your pain, and you can take laxative for your constipation. Do you think you can do that?
Yes, yes, doctor. But
Mhm.
uh, doctor, one of my friends had constipation, like, he has problem with his tummy, like a similar problem.
Mhm.
Then he underwent the surgery. Do you think I need to go for any surgery for this problem?
Okay, Mr. Ashir, this is a very good question. I would like to reassure you that your constipation is a moderate constipation, and usually moderate constipation is response to treatment. So at this time, at this moment, there is no indication for surgery. Am I
Okay,
clear so
doctor.
far?
Okay, doctor.
Okay, Mr. Rashid, do you have any other concern?
No, doctor. Thank you.
Okay, and I wish you a speedy recovery. Thank you.
Thank you, doctor. So 5 minutes and 10 seconds. So your time management is good. Excellent. So overall is good role play, Dr. Lover. I will give you B grade.
Okay.
But there are some points that we always can improve. Yes or no?
Yeah, that's right.
So
Yes.
yeah, we can improve a little bit more. So what do people think? What should be the score? Those people who are with us on Facebook, what should be the score for this role play? So first you forgot to use the open question at the start, okay? But then you
Then I
remembered,
remember.
and yes, so the problem when you start close question like when did it start, okay? Then
Mhm.
you are not allowing the patient to give the information that he wants to give, okay? So if you
Mhm.
ask me a close question, I will give you close answers, because if you ask me about onset, I will tell you about the onset, okay? If you
Yes.
ask me about the uh, duration, I will tell you about the duration. So things depend upon, okay? Yeah, he is very confident. Thank you. So we need to sorry, I forgot what I was telling. So open question, yeah. So when you tell open question, this is the chance that patient will give you information, okay, a lot of information. So please use the uh, open question at the start. And
Okay.
then yesterday, a day before, I told you to show sympathy and empathy in different ways. Not only I'm sorry to hear that, but today you didn't show any sympathy for my problem.
Okay.
Not even a single word for my problem. Just you keep asking what happened next, and then this is the problem, this is the treatment, but you're not showing real like sympathy for me and this. Okay, no C plus, no, this is B grade overall. Okay, but still we need improvement. And okay, so you didn't show any sympathy. And when I'm telling you problem, oh, this is my problem. Yes, Mr. Bashir, I can understand that you are, you have problem with your tummy, okay, with your bowel. But please, could you tell me how often did you take the medication? Whatever question is on the next. Okay. So first, like when the patient tells something like problem, a crisis, a problem, just acknowledge, show sympathy, and then go whatever you want to ask next. Okay. So here, as I was telling in the criteria that you need to go for sequencing to this and that. So just you are not using very good sequencing in this bullet point second last, where you can use a very good way to do the sequencing. First of all, you didn't even you forgot to mention ambulation. I think you were not ready how to explain ambulation. This is
Yes,
just
that's right.
early walk, okay? So you need to
Mm.
start walking as early as possible, and how much you can. Just try to walk. Good, don't keep sitting or keep lying on the bed. Just try to walk, okay? So apart from that, first of all, do this. And apart from that, what you can do is if you eat a high fiber diet, it would also help you to relieve your constipation. Do you think, Mr. Smith, can you do that? Yes, doctor, I will try. So apart from that, Mr. Smith, another thing is that you that can help you. You can try to do exercise. Just do gentle exercises. As I know that you were operated for a femur fracture, so still you cannot do very strenuous exercises. But just try to do as much as you can. Just start with slight exercises, and also please drink plenty of fluids so that you keep yourself hydrated, and it also helps to avoid constipation. Don't make it too long, but at least divide and explain a little bit better way.
Okay,
When you
sir.
are explaining about paracetamol, as you told me, Mr. Smith, that you are worried about your pain also. So what alternative I can give you? You can just take paracetamol. If you take only paracetamol, it will not result into constipation. It will not cause constipation, whatever. Okay. So like this, use sequencing. Okay.
Okay, sir. But is it mandatory to like mention all the points in
No,
sequence?
is not obligatory to mention all and not obligatory to mention in sequence. But if you can do that, would be better because these are written mostly in logical order. Okay. So now this is your next role play. Let me stop recording. Okay, 2.5 minutes to prepare, please.
Okay, sir.
Okay, let me know when you are ready, please.
Okay, you can start now, sir.
Okay, start, please.
Hello, good morning. My name is Dr. Laur. I'm the treating doctor for today. And how can I address you, please?
Yes, doctor, I am Jenny.
Okay, nice to meet you, Jenny. And how can I help you?
Doctor, you can see my 10-year-old boy here with me. The problem is, doctor, he is having some problem with his urine.
Okay, I'm really sorry to hear that. Could you please tell me more about your child's condition?
Doctor, actually, he is passing blood in his urine. for the
Mhm.
last, 1
Okay.
week. And,
Mhm.
I'm really worried uh,
Mhm.
what it could be.
Okay, Miss Jenny, I'm really sorry. Actually, it must be stressful for you to see a blood in urine. So before you proceed, uh, I would like to ask you a few more questions.
Okay.
Okay, does your child has a fever?
No, doctor.
Okay, what about cough?
No, doctor.
Okay, Miss Jenny, I would like to order some investigations. Uh, one of the investigation includes blood test. The second one is urine test. And the last one, which is the most important one, is ultrasound of the abdomen. Do you think you can do that?
Are these tests necessary, doctor?
Uh, yes, Miss Jenny, this is necessary to know to do a urine test to see if there is any infection in the urine. And also the blood test is important to see the bleeding time and clotting time. Yes, this is necessary.
Okay, okay. But
Okay,
doctor, he has never had this problem before because he is 10-year-old and he never had any problem with his urine. And I'm really concerned why he is having blood in his urine, doctor. Is something serious, doctor?
mhm. Okay, Miss Jenny, I can understand your concern. It must be very stressful for you to experience your child experiencing these symptoms. Now, I would like to reassure you that this is a not serious condition. This is something common in childhood. And I would like to reassure you, this is not a malignant. And usually this is resolved on its own. And most of the time, this condition no need any treatment. Am I clear so far?
Okay, okay, doctor.
Okay, Miss
But
Jenny,
why he
now,
is having these, doctor? Why
okay,
he having blood in the urine, doctor? What could be the reason, doctor?
okay. Ms. Jane, this is a very good question. Let me explain it to you that the causes of blood in urine includes urinary tract infection, like the infection in the urinary system. This is number one. And the number two is infection in the kidneys. And the last one is the uh, condition called Wilms tumor, which is a kidney. Uh, this is a kidney mass. This is a mass on the kidney. But I would like to reassure you that this is unlikely to be a cancer or any serious condition. Are you following me?
Yes, doctor.
Okay, Ms. Jenny, do you have any other concern?
No, doctor, thank you.
Okay, Ms. Jenny, let's talk about the preventions. In order not to this condition to occur again, I will advise uh, to take more rest. And another thing is avoid heavy exercise. Uh, another thing is avoiding eating bad food like junk foods. And the last one, which is the most important one, is drinking as much as fluid as possible.
Okay, doctor.
Do you think you can do that?
Yes, yes.
Okay, Ms. Jenny, do you have any other concern?
No, doctor.
Okay, thank you.
Thank you, doctor. So time management is good. Again, 5 minutes. Good. But still, there are, doctor, many points that we can improve, especially you are hesitating.
This time, yes, I noticed some,
Yeah, yeah, hesitation. Okay, you should avoid hesitation.
yes.
So just I'm looking for. So what do you people think? Those who are with us on Facebook, what do you think? Okay, so Overall is good. Still, I will give you B grade, but not very good B, just 350. Okay. We don't need to say a blood because with blood we don't use articles a blood. Okay. With tests, you are saying this tests is these tests because it is plural. Then you said this symptoms, this is singular, symptoms is plural, so is you know subject verb agreement problem here. These symptoms. Then this is resolved. So some grammatical issue here. You were just telling something like that. Okay. Malignant, you don't need to say malignant. Is not malignant. You say it is benign condition. It is not serious. It's not cancer. You can say it is not cancer. Malignant is for us, for doctors and nurses. So malignant is not for patients. So for patients, we should use simple language. Okay. Say cancer. Okay. Not something benign. You can say.
Okay, sir.
So then you said causes includes, causes is plural, includes is used for singular. So this is your again subject verb agreement error. But Wilms don't say mass, don't say is Wilms tumor, that is type of kidney cancer. When we are explaining cancer to a patient, we should directly say it is, like cancer, not say, don't hide the things. Okay, just say it could be, sometimes it could be a Wilms tumor, that is type of kidney cancer. Then your explanation of this was good. Just infection in kidneys, infection of urine tract, and this is was good. And then don't overuse another thing, that you are using, overusing another thing is that, another thing is that. You don't need to overuse things, the sequencing. Just keep it natural. Sometimes yes, sometimes no. So just keep it natural and good.
Okay, sir.
Okay, so overall, just we need a little bit improvement. So overall is good. So let us do one more role play, but we will do offline. No. So those people who are with us on Facebook, we have 50% discount nowadays on our writing course. Dr. Glover, you have completed your writing course. Are you happy with the course or not? Writing course.
Yes, actually, when I started with you, Doctor, my level in C grade, and even in the exam, I got C 250. But after your course, your hybrid course, I saw many improvement in my writing, and
Yeah, even I wanted to help you more, but the problem is you were too busy
my
and
time,
you
yes,
were and
yes,
yeah, because but you have written more than 15 letters, over
yes,
almost 20 letters.
around 20, around
Yeah,
20, yes,
but still, I wanted to help you with more letters without extra charges, but you were too busy.
yes,
But let
that's right.
us let us hope for the best, okay? So nowadays we have 50% discount on a VIP hybrid course. So if any of you wants to join, you can, okay? So thank you so much. So tomorrow we have reading class at 4 p.m. UK time. Tomorrow we have reading class at 4 p.m. UK time. Thank you so much.